will now begin. Gynecologic oncologists who have seen this program tell us that this is a presentation that has essential content for every gynecologic oncologist. I would now like to take the time and the opportunity to introduce Linda Koteen from SHARE.
My name is Lorraine Bajada, and I am a 10-year ovarian cancer survivor. I, like so many women, had persistent symptoms of ovarian cancer long before it was diagnosed. However, because those symptoms were so deceptive, they were easily explained away. Since the symptoms are not necessarily gynecologic, many women may visit an internist, a gastroenterologist, an orthopedist, a urologist, or yes, even a plastic surgeon. Wherever they have taken their complaints, the most common experience has been a delay of months before a diagnosis of late-stage ovarian cancer and hopefully an appointment with a gynecologic oncologist. I would like to give a voice to some of their experiences. I'd wake up feeling like I was getting the flu, only I would never get the flu. A feeling of uncontrollable tiredness came over me. I was told my symptoms may be from depression. I had pain in my stomach and bowels. My gynecologist told me the vitamin C I was taking could be causing gas. It also could have been emotional or food allergies. I had the urge to urinate constantly. The doctor said it was a menopausal bladder. Although I was on a diet, my clothes were getting tighter around the waist. My doctor said my body was changing with age. I had bloating, indigestion, and unusual bleeding, but I did not go to the doctor until the pain stopped me in my tracks because I had no medical insurance. As you can see, many women were on a search for a diagnosis long before they came to your office. My own personal experience started many months before I was diagnosed. I'd complained to my gynecologist about pelvic pain and irregular and excessive periods. I was also having unusual fatigue and urinary frequency, but both of those symptoms I assumed were from multiple sclerosis, which I had been diagnosed with 10 years earlier, so I never thought to mention it to my gynecologist. Even though I was 43, my gynecologist told me I was having perimenopausal symptoms and to let nature take its course. I waited until I was bleeding for 16 days in a month before returning to my gynecologist. It was at that time, after a physical exam and a transvaginal ultrasound, that I was sent for a CAT scan. And 9 days later, I had an appointment with a gynecologic oncologist and was told for the first time that I had ovarian cancer. As devastating as that news was, I can still remember sitting in his office as he told me there is no cure for ovarian cancer, but that I was in the right place, that he would remove as much of the cancer as was possible, and that when I was in the hospital recuperating from my surgery, a medical oncologist would come in to see me and discuss the treatment that I should have to fight the ovarian cancer. There was a plan, and for this, I was incredibly grateful. I am one of the lucky women that already had strong faith, a wonderful family, and supportive friends. But I was learning quickly I was going to need a lot of additional help to fight ovarian cancer. A team of doctors that were not only incredibly talented, but equally caring, that made me feel I was not alone in my battle against ovarian cancer, and that they would help me get through the tough times. So thank you to each of you that has done for your patients what my doctors have done for me from the time of diagnosis until now. After the long battle, it often takes to receive the correct diagnosis, ovarian cancer survivors can finally begin treatment and the fight for their lives.
Hello, my name is Carmen Diaz. After seeing 5 different doctors who could not explain my growing abdomen, I went to see a plastic surgeon to have a tummy tuck. It was then that I was diagnosed with stage 3C ovarian cancer. But I'm here today to talk about treatment issues. When I think about the issues I experienced while receiving treatment, I must admit that the nurses come to mind first. That is probably because the nurses who treated me were the ones who really told me what to expect, what to fear, what to watch out for, and most importantly, how to cope. My doctors told me with chemo I would lose my hair, experience some nausea and vomiting, maybe some joint pain. But they couldn't tell me how emotionally devastating it would be. My doctors told me I would lose my hair. My nurses were able to tell me to the day when it would actually start happening. My doctors told me I would experience fatigue. They didn't tell me I would need to take a short nap after a short trip to the store. My doctors told me that with intraperitoneal chemotherapy, I would increase my survival rate by 16 months. I didn't understand that the increase in survival rate came at the expense of life-threatening side effects. The vomiting got so bad that I would need to be hospitalized for weeks. I felt so sick that at that moment I knew why cancer patients give up. Until I heard the words from my doctor, I didn't know I could have died. I didn't know that I would experience that strange combination of extreme exhaustion and restlessness due to the steroids that would keep me up half the night. I didn't know that funny taste in my mouth would be so bad that I wouldn't eat anything. Between the not eating and the vomiting, I would end up sicker. I didn't bargain for the weekly shots of Pocret and Neulasta long after my chemo was over because my poor blood count took such a beating from the drugs. Nor did I anticipate the persistent joint pain and stiffness I still experience 3 years later. I was told I would lose my hair, but I could not have imagined the negative effect it would have on my sense of self and my sense of womanhood. Too often, people think it's only hair, but it's the only sign letting people know I have cancer, and there is no escaping it. I guess when one administers this kind of treatment every day, it is probably easy to lose sight of the fact that in the face of cancer, most patients will do almost anything to grab hold of that elusive remission. And in the process, all the tests, needles, doctor's visits, pokes and prods, we lose the very self we are trying so desperately to preserve. To be fair, I must acknowledge that the list of treatment issues is probably endless, and it will be pretty difficult for any doctor to advise patient of them all. But it will be helpful when a patient comes in describing the unexpected side effect to have her concern acknowledged. When we are told we have cancer, we are scared to death. Not knowing what comes next is even scarier. But maybe, just maybe, all that we are told won't happen. But we will be prepared for whatever comes next.
My name is Joan Sommer. I'm a 15-year survivor of stage 4 ovarian cancer. After 5 different chemotherapy drugs, multiple surgeries, and endless side effects, I heard the words all cancer survivors look forward to. Congratulations, you are in remission. My husband and 3 young children cheered, whooped, and proceeded to expect the old mom was back in business. Their expectations rose to include laundry, soccer games, meals, and rides, everyday things I had been unable to do for them. Nothing was further from the truth as I struggled to understand this new limbo called remission. Now what? Will it come back? How can I go without seeing the doctor every week? I'm bloated today. Is this recurrence? My body was dramatically changed by surgery, chemo, and lack of activity. I no longer trusted it since it had betrayed me with my cancer diagnosis. The doctor said my cancer was gone. Why did I still feel so scared? The volume button on my cancer was extremely loud. Cancer, 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 cancer. I could think of and focus on little else as his screeching sound played over and over in my thoughts. As I slowly reconnected with what I loved and enjoyed, my tiny world of cancer treatment began to expand. I needed to gain control of the volume button. The fear of recurrence in ovarian cancer is palpable in survivors. It is the #1 thing on all our minds. The statistics are overwhelming. How do I sustain my hope in light of these numbers? I read, get other opinions. I talk with as many survivors as possible, looking for any clue to prolong my remission. Should I return to my busy life or just enjoy my remission, knowing I will soon recur? I didn't recognize the disease the first time. How will I spot it now? There are no gold standard answers for this period of limbo. I must learn to live in this space of great uncertainty. I buy a pair of shoes one day, no longer afraid they may outlive me. I decide to get a crown on a broken tooth, no longer afraid I will die immediately. I make plans to travel 2 months ahead of time. I am slowly moving and living. I return to work part-time. I live my life in 8-week blocks between office visits and my CA-125 blood test. They are normal. My hope sails, and the next 8 weeks are filled with adventure, fun, and love. I am grateful to be alive. My marker, less than 5 after treatment, is suddenly now 24. They say not to worry, it's still under 35, 52, 76, 102. My transvaginal ultrasound, negative. My CAT scan with contrast, negative. My pelvic exam and chest x-ray, negative. I am told to wait and see. The volume gets louder and louder. Cancer, cancer, cancer. I am confused. How can initial treatment be such an emergency, yet recurrence with rising markers a wait-and-see approach? It continues to rise till at last a PET scan lights up in multiple areas. It is no longer a fear. It is reality. My ovarian cancer has recurred. I know what lies ahead. Again, my dreams are on hold, and I must embrace my treatment plan. My odds have changed, and I am scared. Why is there such a clear initial standard of care, yet when I recur, it's up to me to choose between a plethora of drugs I know little about? How do I go about choosing a treatment that won't hinder future options? When do I seek other opinions and clinical trials? Where do I begin to understand and choose between an alphabet of options? And so the volume button of cancer blasts in my ear once again. I have heard my next remission will be even shorter. I must begin to deal with the reality I will never be cured. It has taken me so long to regain my footing. How will I do it again? I must focus and continue to find hope. They say my ovarian cancer is a chronic disease. It can be treated over and over with many different drugs. My sister has a chronic illness. She takes pills with really no side effects and sees her doctor twice a year. She lives her life fully and expects to grow old. Ovarian cancer doesn't feel or look that way to me at all. It is in your face, full of anxiety and difficult treatment options. It requires weekly doctor visits, medications to treat significant side effects, and a full-time commitment to treatment. Chronic does little to explain this overwhelming process. Make no mistake, ovarian cancer is not chronic, it is deadly. My treatments begin yet again, and only this time I am well armed. I have spent time with other ovarian cancer survivors and heard their stories. I have learned better ways to ask my questions and communicate my side effects. I have learned that it is okay to be hopeful. 15 years after my initial diagnosis, I have learned that surviving and living with ovarian cancer is not an arbitrary period like 5 years. It is an everyday thing where you wake up, take a deep breath in spite of your fears and pain, and find a way to take your place in the world. Surviving cancer is not a place you strive for in the distance. It is here and now. You are in it, and it is up to you to be part of it, to find your hope. Hope is falling asleep and expecting to wake up each day in spite of what you might have heard. It is thinking about the possibilities, not the probabilities. It is preparing to die, but expecting to live. When faced with uncertainty, there is nothing wrong with hope.
My name is Annie Ellis. I was diagnosed just over 3.5 years ago with stage 2C ovarian cancer at the age of 40. I have had 2 recurrences, 3 surgeries, including a partial liver resection, and 5 chemotherapy regimens. I am here to talk about hope. It is hope that guided many of us survivors here today from a terminal diagnosis to survivorship. We believe there is no such thing as false hope. There is always something to hope for, and sometimes hope is the only thing we have to hold on to. We hope to be treated as individual women, not a statistic. We know the odds are slim, yet we hope to be one of the few who will be cured. We hope for a remission and for life to feel normal again. We hope that there won't be a recurrence, but if it happens, we hope for another remission, and another, and another. Then we hope for stable disease. We hope to qualify for clinical trials. We hope the next course of therapy will be the one. We hope that we don't run out of treatment options. We hope to live long enough for researchers to find a cure. As the disease persists, we hope to find ways to minimize and tolerate the cumulative side effects of multiple chemotherapies. We hope that ascites will not return. We hope that bowel obstructions will resolve on their own. We hope that pain will be well managed. We hope for more good days than bad. Throughout the journey, we hope our doctors know how thankful we are for their compassionate care. We hope they know how important they are to us and how significant every word and gesture is. We hope our relationships with our doctors are filled with integrity and mutual respect. We hope they will communicate as much or as little information as we need. We hope our doctors will hear us when we share what is difficult for us and address our concerns. We hope that they will respect our decisions when we want to be treated aggressively and when we do not. We hope that they will understand our desire for psychological and spiritual support. We hope that our doctors will encourage and promote our need to connect with other survivors, because meeting a long-term survivor in person is an infusion of hope like no other. Despite everyone's best efforts, many women will still die. We hope our doctors will have the strength to continue to do the hard work it takes to support and care for women living with ovarian cancer. And if the time comes to discontinue treatment and let the disease take its course, we hope our doctors will help us make the difficult decisions with courage, dignity, and grace. We hope for a test for early detection and a cure so that our sisters and daughters we'll have other things to hope for.
My name is Judy Gordon, and I am most fortunate to be an almost 8-year survivor of malignant mixed mesodermal tumor of the ovary. What I am presenting today comes from discussions I've had with women in our support group as they faced their deaths. All of them fought the disease and did not want to give up. However, as their cancer recurred and became resistant to chemo, a time finally came when they were letting go. From our perspective at SHARE, we are aware of how difficult it must be for the healthcare professionals to be involved in the care of women with ovarian cancer who have come to the end of their lives. We know you see yourselves as healers, and when there is nothing left to be done to treat the disease, there might be a tendency to withdraw. You may arrange for your patients to receive the appropriate end-of-life care, making referrals for palliative care and hospice, but it is also important for you to maintain a connection with the patient and her family. After a woman has been treated by you for 2, 3, 5 or more years, the relationship is important. To have this connection end abruptly can and does add to the distress a patient is experiencing. One theme came up time and again. Many women felt abandoned by their physicians. Their doctors who were there while they were undergoing treatment often withdrew from them at the time that they were dying. One woman said that her doctor told her there was nothing more that could be done and did not come back during her last week in the hospital. She was devastated by this. Another woman said that she felt her doctor could not cope with seeing her, that he came into her room and could not meet her eyes. She thought he saw her as a failure. This may not represent the physician's feelings, but this was how it was perceived by the patient. In contrast, one woman spoke of a resident who came into her room, asked if she needed anything, and when she asked him to stay with her for a while, sat with her, holding her hand for 5 minutes. She was able to tell her family and friends how much this meant to her. We do recognize that not being able to save everyone is incredibly difficult for you. You were there treating and caring for your patient. We ask you to perform one last service, that you are there to say goodbye.
Thank you so much for sharing your stories. Thank you for taking the time to share your stories with us. It's very important for doctors to hear this, as well as other women. Thank you.